All right, well, good afternoon and welcome to today's solution session hosted by ERS. My name is Bernie Hayaski with the Enterprise Planning Office, and with us today are representatives from Onduo. They're going to be telling us about their services related to diabetes management. Ground rules for today's session. Onduo will have up to 45 minutes to present, followed by some time for question and answer. Please be sure to speak up. Today's session is being recorded, so for those who view the recording, we want to make sure that your question and also the responses are heard. So with that, I'll go ahead and turn it over to Amy. Thanks.
Thank you. Hi, everyone. I'm Amy Pravanchi with Onduo. Thank you for having us today.
My name's Matt Scholl. I'm Vice President of Business Development with Onduo as well.
And actually, Matt's going to kick it off, and then you'll end up hearing me talk an awful lot as we go through this presentation. But again, appreciate the time today.
Great, thank you. So just by way of background, a little bit about Onduo. We are a joint venture fully owned by two partners, Sanofi, as you may know, the large multinational pharmaceutical company, and Verily being the life sciences arm of Alphabet, the parent company of Google. So a number of years back, Google wanted to re-enter the healthcare space, and as opposed to when they first entered in around 2008 and tried to go it alone and develop a lot of technologies and capabilities themselves, they realized, partnering with other experts, domain experts in healthcare is valuable, and Sanofi was an excellent choice and likely pick for them to partner in diabetes with 100 plus years track record in diabetes management. So the outcome of that was a 50-50 joint venture called Onduo. Onduo is a play on words for the Latin of onward and together, and part of our motto is to really be the best bring the best diabetes care to anyone, anytime, and we do that through a number of digital solutions backed by hardware solutions and consulting services, including clinical services. We believe we're big believers that health happens at home as opposed to just in the doctor's office. The 360 some odd days a year that you're not at your doctor's, you still need to manage your type 2 diabetes. And we found that it was really important to meet people where they're at, to bring them innovative solutions that were simple and easy to use, but have that human touch with coaches, certified diabetes educators, and clinicians, including endocrinologists, that members, employees, health plan members could reach out to and consult with to better self-manage their type 2 diabetes. You're probably familiar with some of the statistics about how difficult it is for individuals to really get the quality care that they need. Rarely will they spend much more than 30 minutes in a doctor's visit, maybe once or twice a year. For those suffering with type 2 diabetes, they need to see an endocrinologist on a regular basis. That oftentimes is very difficult. Depending on the state that you live in, you might have access within minutes of a simple car drive, or for others that live in large states with a large rural population, it could conceivably be hours for you to drive to see your endocrinologist, and it might take you up to 6 months to get an appointment in the first place. We bring a virtual solution so that individuals can really have their needs met when and at a time that's more convenient for them. We're just a little over 3 years old now, and when we complete this month, we'll have completed the second full year of working with members. So we're still relatively young, but in that short period of time, we've learned a lot about what's really working for us and for our members. And we found that across the continuum of care, if you see in the slide here, we'll bucket individuals into different levels of risk. Those that are lower levels of risk, say an A1C of 7 or below, generally can self-manage fairly well. You've got some in the middle that they're starting to trend probably in the wrong direction, and they need a higher level of care. And then you've really got those high-risk individuals with an A1C of anywhere from an 8 or 9 and above, and we've seen 12s and 14s, which is pretty scary. Those individuals need a higher level of care, and they need interventions brought to them through a clinician, through an endocrinologist. And so our telehealth, our telemedicine abilities allow them to have those interventions at a time that's convenient for them. We've really started to zero in on where Onduo is really moving the needle is with that higher risk population. We'll work with the entire type 2 spectrum, but we're really making some big changes in people's lives when it comes to those higher levels of A1C. We'll talk a little bit about those results and share some of the statistics with you briefly. So again, it's about matching individuals with the right program, the right level of intervention. We bring, you'll see on the slide there, we bring technology through a smartphone-based application, Android and Apple smartphones, both platforms. We use connected meters, so a wireless glucometer, a TelCare meter, so that anytime that the individual fingerstick blood tests, that data is transported to the cloud. It's safe and secure. Our platform accesses that data. Both the app and our coaches have access to all that A1C or all of the blood glucose readings. And that becomes a really important teaching tool for the member. I'll come back to that in a moment. The other thing that's extremely different about our program and approach is we're utilizing continuous glucose monitors. So a CGM, which is a technology that traditionally has only been used with type 1 diabetics. It's a small monitor, electronic monitor that individual places. There's a small needle that goes into the skin, inserts. They wear that monitor for 7 to 10 days. And instead of manually fingerstick blood testing 3 or 4 times a day, that monitor will take readings throughout the day up to 300 times. So you're getting this really wealthy, rich data set that, again, it allows for the individual and their clinician or coach to really kind of help them make inferences on how their daily behaviors are impacting their blood glucose level. So the things that you're eating, how is that changing your glucose? Whether you're exercising or getting enough sleep, all of those things can then be recorded. We match those applications and technologies and devices, again, with individuals, live people, whether they're coaches, certified diabetes educators, or doctors, again, employed by Onduo, endocrinologists that work for Onduo, to provide the level of care that's needed for each individual. All right, hand it off.
Thank you. All right, so Matt did a pretty good job of setting it up, and I'm going to break down a little more detail as we go through the piece here. But I want to start with the fact that Onduo really believes that one size does not fit all. So everybody's journey with type 2 diabetes is a little bit different. You've got people who I'll call the worried well, who are maybe managing themselves pretty well. They're really interested in how things go, and they're going to be successful with just an app and a meter and a blood glucose monitor. And then you've got people who are not going to be successful. They're going to need that extra motivation. They're going to need that interpersonal communication with someone else to get that motivation to really set them on the right track. So the way that our solution works is to define those care plans on an individual level and, again, match the equipment for the proper journey in front of the individual. So we'll talk through how that works a little bit. One thing I do want to highlight is that we've spent a lot of our time really investing in clinical care, and that's important, again, because of that personal touch. So we started out with a lot of tech, thinking, tech was going to be the way that we changed how diabetes was managed. And I think that that's true, and it's really important, but we also discovered that people need that personal touch. So now what I would say is that we have kind of that perfect formula of cutting-edge technology and personal touch to really help to bring that individual into the fold, get them motivated, get them empowered, and help them understand how that daily cause and effect of the decisions that they make impact that glucose level. So, as Matt alluded to, we offer appropriate, effective, individualized care plans based on that risk level. So this is an idea of how things could work. So we stratify into two different risk buckets, low risk, high risk. And you'll see those care services to the side, including the welcome kit CGM. So we'll level set by saying everyone gets a welcome kit. We want everybody to come in feeling like they have the tools that they need to manage their diabetes. So they're going to get that cellular blood glucose meter. They're going to have strips. They're going to have a lancing device. And then separately, we're also going to mail them an A1C test kit so that we can get a baseline A1C on everyone in our program. Everyone also has a care lead. And so with that care lead, I think it's really important to call out that it's not a call center. This is an actual individual human being that is assigned to the member. So that member builds that relationship, and that care lead really becomes an extension of their primary care physician. We do work with PCPs really well. People are not required to have a PCP to be in our program, but we are able to close that care continuum once that care lead starts working with the individual. If an individual is moved into high risk, and we're going to define that with an A1C higher than 8, utilizing a medication that we know has a propensity towards hypoglycemia, so insulin, sulfonylureas, say they've been hospitalized within the last 6 months or they haven't seen a PCP within the last year. We're going to probably move those guys into the higher risk group, and that's where our members are going to start seeing some of those services that Matt was talking about with use of CGM, which we'll talk through a little bit more, telemedicine visits with certified diabetes educators and with endocrinologists, all of whom are on staff at Onduo. So I kind of hit on that investment of deep clinical care. We spent a lot of time really rounding out the solution because we know that 20% of individuals actually account for about 60 to 80% of costs depending upon your specific population. So again, these are the folks that are going to need a little more help. They're going to still have that care lead and they're going to have that daily interaction. About 90% of the communication is done through asynchronous texting through the app, but we do have the ability to have face-to-face as well when we move into that endocrinology and telemedicine visit. So CGM, I actually get really excited about this kind of thing for a few reasons, but one of those is that it provides really rich data streams. So you can take a blood glucose monitor. The average person with type 2 diabetes, if we're lucky, is going to test 1 to 2 times a day. Typically, that's going to be around the same time of day. So you're going to know every day that Bob had a blood glucose reading of 157 at 2 in the afternoon. But it's kind of like, who cares, right? So what a CGM does is bring in what happened to Bob when he woke up in the morning, what happened when Bob ate a bagel at 10 in the morning and then went on a walk at 1 in the afternoon. Now we know that that blood glucose reading of 157, the cause was the bagel that he ate and the walk that he took that helped to even out or not provide such a spike in that blood glucose reading. So that continuous glucose monitor really provides that insight and helps to cement the cause and effect. What happens when I do this to my blood glucose? And now you know when you look back, eating a hash brown at 10 o'clock in the morning spikes my blood glucose 200 points, where if I have an apple with peanut butter, that's only 50 points. So we love CGMs and the insight that they bring. I also want to call out that Onduo is the only company who can prescribe and ship a continuous glucose monitor to an individual's house. It goes directly to their home. That saves a lot of time for the individual. It saves time off work for the employee, and it enables them to immediately start getting that rich set of data from that continuous glucose monitor. 67% of members weren't even aware that these things existed until they started in our program. So it's pretty awesome to know that going from something that you don't even know exists to 95% of people feel that wearing a CGM makes it easier to perform their behaviors. Again, it's back to that understanding, right? It's knowing what happens when you make decisions during the day and seeing the result of your decisions that really helps to drive better behaviors over the course of time. So a little bit of outcomes data. I know that is a little bit of an eye chart and maybe a little hard to read from the back of the room, so I'll highlight a couple of things. So this is called a whisker plot, if anyone hasn't seen these before, and I find them atrocious to read, so I'm just going to go through the key highlights here. As you move from A1Cs of 7, so these are people who are pretty well controlled with their diabetes, you're not going to see a lot of difference wearing a CGM. So we'll often get the question, when do you choose to prescribe that CGM? Typically, it's not with that group who already has an A1C of 7. They're probably controlled. They're probably reading their blood sugar a couple times a day. They're just going to need a little continuing guidance and some motivation from their care lead. The same as you move in to the next bracket up here, so 6, 7's pretty well controlled. As you start to move into that A1C over 8, you really see an impact from the wearing of the CGM. So the 2 bars that you see, the blue and the orange, or yellow, the yellow is wearing the CGM, the blue are not. So this is the same A1C stratification, but if you're looking in that 9 group, that CGM result was a 3.54 reduction in A1C. That's huge, guys. If you aren't too well aware of typical A1C reductions, 3.54 is an outstanding reduction in A1C. Even when not wearing the CGM, we're seeing a 2-point result. And that's also because these individuals are getting services, right? They're getting med reconciliation, they're meeting with endocrinologists, they're having that daily care. So we're still going to get that A1C drop, but the insight from the CGM helps to really drive that behavior change and really motivate people to do as well as they can during the course of the day, because they are seeing in black and white in front of them what their decisions are doing to their blood glucose control. Matt touched on this a bit. So it's really important in rural populations in particular to have access to something like a telemedicine visit. You can see from the heat maps here the diabetes prevalence versus the amount of available brick and mortar specialty care. They're kind of far in between. There can be a very long drive for individuals. It takes a lot of time out of the day, and it can be about a 3-month wait time. So by having the doc in your pocket with a telemedicine visit, it makes it really easy for the member to seek care and to have changes to their regimen, not only from a medication perspective, but just a daily life perspective. So that report that you see up in the corner is actually something that is on the app for patients to be able to take back to their primary care physician. So it kind of level sets that care continuum for the primary care as well, where they can see what an individual has been doing with their type 2 diabetes management over the course of their time on an Onduo platform. So med optimization touched on this a bit. So I'll kind of back up a little bit and let's talk about insulin. So it's not something that typically primary care providers love to prescribe. It can be difficult to calculate a dosing. It's a largely paper process to dose correctly and to titrate to the correct dose for the individual. And so it's often just avoided. So what you'll find is a lot of people on 2-3 different oral medications, where one long-acting insulin would probably have sufficed for that individual. It saves money. It saves a lot of time in getting someone to goal. And the beautiful thing about having an endocrine who knows and understands how to calculate that insulin dose with Onduo platform is that it happens really quickly. The follow-up's quick. We follow the blood glucose and we get that individual to the proper dose of a medication and get them to the desired outcome much faster than a brick and mortar specialty would be able to do. So it's oftentimes about that proper med and the proper dose of a med, but it's also about taking into account what is on formulary for the individual, what's going to drive that cost down for the individual, and how can we help from a holistic perspective with reducing the amount of medications while improving the lifestyle. So it is that whole kind of gamut of care for type 2 diabetes. I love this chart. It's kind of fantastic. So you have a whole bunch of companies listed here who are really well known for their customer service, and their NPS scores are very high. We are so pleased to say that our NPS score at Onduo is 78. We're beating out Amazon and Apple. That's exciting stuff, right? And if you talk to the people who are on a CGM, the NPS score in that particular group is actually even higher at 84. And again, I go back to understanding what's happening with their diabetes management and why they start to love our program so much. And it also, again, is that singularly assigned care lead that they build that relationship with. Long-term engagement is kind of an important thing when you're dealing with a lifetime chronic disease diagnosis. So at 70 weeks, which is where this chart goes, and I'm sure you guys in the back of the room can see that 70, so I'll call that out, 70 weeks, 61% of people are still engaged. Any who have been on our platform, we retain 61% of people through 70 weeks. That's pretty huge when you're talking about something as monotonous as diabetes management. We also look at the whole person. So we look at steps. Our app integrates with Google Fit and Apple Health, and so as long as the phone's with the individual and they've given us permission to track steps, we're going to go ahead and track that activity. We have a weight loss 8-pound average, pretty solid amount of weight. Also, another plug for med reconciliation: as people start to lose weight, they need less meds, and so we're able to monitor that pretty quickly and kind of avoid those unnecessary clinical escalations for things like hypoglycemic events. Overall diabetes distress score, 30.8% improved. So I'm probably not shocking, right? Diabetes and depression go hand in hand. So we want to make sure that when we're managing diabetes, we're taking the whole person into account, and that includes mental states. So we do continue to follow diabetes distress. This chart is pretty fantastic to show that regardless of the risk stratification, we're able to improve a percentage of that population. So in that A1C grouping over 9, 90% of the folks in that group improved. In the A1C grouping over 7, 48.66 improved. So if you're questioning why, that's because those guys are under control. So you're gonna have a little bit of recidivism sometimes in that group of 7, but being able to improve an already controlled population with 50% of those guys improving A1C, is also pretty phenomenal. This is a longitudinal analysis of an A1C over the course of a year. So also important to understand, when we have that initial A1C drop, are we going to have any recidivism back to the mean as we go through the year? And the answer to that is no. This A1C grouping by our population had a significant drop from the mean, and we were able to maintain that same A1C over the course of the year. So always just good questions to ask of other vendors when they come in. Make sure they can show you their longitudinal A1C reduction by a population level over at least the course of a year, because you don't want those guys slipping backwards. And I love this. Sorry, I get really excited about data. So this was a beautiful opportunity with one of our larger health plan customers to take a look at everyone who was offered the Onduo program who was diagnosed with type 2 diabetes. So this is a fairly large population of individuals. And after a year had passed, we took the grouping of individuals who had enrolled versus the grouping of individuals who had not enrolled. And what it shows is the Onduo program, even at the lower A1C rates, we're able to maintain that control, even at the 7. And when we get into that A1C over 9, so more of an uncontrolled group, you're able to see a significant drop in A1C versus individuals who were not utilizing the Onduo program. And yet another look at outcomes, because we're pretty proud of them, if you can't tell. So this is a lot of the same information, but in kind of a population chart. And you guys will have access to this, so I'm not going to walk you through every line, but just know consistently with our populations, if we've been able to measure them, have shown significant A1C drops and outcomes for our customers. This is a recently published study looking at 740 adults with T2D, just to prove that we had clinical outcomes in A1C. And are you guys getting tired of hearing me say we do a really good job of dropping A1C yet? Because this is yet another route for it. And we can actually provide the link to this study as well so that you're able to read it.
I think one of the reasons that we've kind of gone overboard here is we started a conversation with you all about a year ago, and at that time we didn't have a lot of results. We were still so early. We hadn't even completed our first year with real patients. Now that we're almost 2 years in, a number of studies, a lot of research, and some published peer-reviewed results. So we're pretty excited about it.
Yeah, very. All right, so member experience. This is kind of a linear glance at how we onboard an employee. So I've mentioned several times that it's an individualized path, and it truly is, but there are some consistencies that happen with that member experience. So members are going to receive an invitation. It's going to have an invite code that's going to connect your employees to your account so that we know where that data is going. They're going to register online. We're going to make sure they're eligible to be on the Onduo program. They will meet their designated care lead. There's actually a very cute little video that each of the care leads have pre-prepared so that they can send it to the member so that they really feel like they've been introduced to their care lead. They're going to be talking to them, obviously, over the course of the next amount of time that they're on the platform, but it's a great way to introduce. The individual is going to receive their welcome kit. This picture is a little misleading because the A1C kit is actually included in the welcome kit here, and it now is actually sent separately. We found that it's much easier to call attention to that A1C kit and make sure that we're able to receive that initial baseline than when it gets buried in the welcome kit. So we have separated that. The employee will pair their BGM, and then they're going to be connected to the care lead. And from there is where the paths really differ. They're either going to stay in that group with the care lead where they have that connected meter and the strips and the care lead, or they are going to get moved into the next group up where they may meet with the CDE, have a CGM, things along that sort. So from a member experience standpoint, we really want to appeal to the member from a behavioral standpoint. So we want them to understand what's happening in their daily management so that they feel confident when they're making decisions over the course of a day. We want them to feel supported, feel heard, feel like they have someone to ask even those silly questions to, like I'm standing in line at McDonald's and I'm debating what I order. And we do get those kind of communications back from people on our program. And we want them to feel inspired, really, to understand what's their motivation for wanting to improve their life, what are the things that are hard for them, and our care leads kind of help walk through what can we do to make this easier for you so that you feel inspired and unburdened as you move through this journey. I think from a marketing standpoint, obviously we have to get them to join the program, so we wouldn't be doing our job if we didn't have a multi-touch, multi-channel outreach. But I think one of the things that we do that is pretty exciting from a marketing standpoint is we know it's not a one-time reach out. We're not going to get everybody in the first month. So we really view this as a one-year journey. We're going to have people on board at first, but we kind of have to nurture and get the rest of the folks to join our program. So there are 3 separate series that kind of go along with this marketing journey over the course of the year, and it's going to appeal to different people. One of that's going to be the logic side, right? You need to improve your diabetes, but let's talk about how. It's going to be the emotional side, so people who maybe need a little bit more nurturing, need to feel that emotional connection. So sometimes we'll utilize our clients' names if we're allowed to, which we love to do that. And we'll also start to introduce them to people in our virtual clinics. So we'll send out pictures of our doctors that they'll actually be talking to, or some of the care leads, or some of the things that will happen there to appeal to that emotional side. And then, where'd I go? Logic, emotion. Oh my gosh, you guys, I'm blanking. It's because I'm in front of a crowd right now. Yeah, there's another. I'll come back to it. But the point is, we do monitor those things and what people start to connect with. And if they're not connecting on one campaign, then we'll move that automatically over to another campaign to see if we can appeal to them a different way. So it's definitely, there's a lot of thought behind the behavior change and how we get people to enroll into the app. And our marketing team works really well with other marketing teams to design those journeys that are going to make sense for your employee population. Shock, they're going to register, right? So here's where we're going to enter that code that's going to connect the data, and then we're going to confirm the coverage. We're going to confirm that they should be in the program, and then we're going to have them meet their care lead as mentioned, but definitely good for you to see a couple of the screenshots that the member's going to walk through here. People are then going to onboard. They're going to set some goals for themselves. They're going to tell us not only from a diabetes perspective what may be their goals, but also from a personal perspective, right? A lot of people have goals outside of a diabetes number, such as I want to be able to improve my exercise. I want to, get my neuropathy a little better under control so that I can enjoy my 5-year-old grandson's next birthday party. So these are all things that we work with a member on as they set their goals. We're going to track, so a little bit closer up. So there are a couple pieces of equipment in there that I want to make sure to call out are not included in a welcome kit. We have a partnership with Orpix, which is a foot insert that has a bunch of sensors in there that helps to sense diabetic neuropathy and foot ulcers before it happens, so that we can hopefully kind of prevent some of those things. Those are not, again, included in the program, but it is something that can be added on if you're interested in. We also have a connected scale that's piloting with a couple of populations right now. So if it's easier for the member to work that way towards a weight loss goal, we have the ability to add that onto the program. But what is included is that welcome kit with the blood glucose meter, strips, lancing device, and then as necessary, the CGM and the meter. And I will call out with our pricing, everything is included. So whether somebody uses 3 CGMs, 10 CGMs, 12 telemedicine visits, 5 telemedicine visits, it's a per engaged fee that we'll talk about kind of offline. One of the things that really helps to motivate people are challenges that are aimed at behavior change. So our population will actually work with their care leads to kind of figure out, what are you interested in working in right now? Again, it's not that one size fits all, so we're not prescriptive in what types of challenges they want to do, but if they want to work on weight, we're going to prescribe some challenges that are going to help them there. If they want to work on making better choices with their food to make a better impact on their blood glucose, we're going to work with them there. Some things are like plate challenges or understanding how carbs and exercise impact behavior, things along that line. And this is pretty important. So Matt talked about the CGM a little bit, and I did too. And so I'm hoping that you understand the importance of kind of that rich data flow and why we prescribe that. But the cool thing about utilizing the CGM in sprints is we'll have 10 days at the beginning, typically, and then we'll wait some time after we prescribe a care plan, and we kind of go through some things, and then they'll be prescribed for another 10 days, where we can now see, what are the improvements that have happened, or maybe what are some areas that are still kind of causing some struggle for you. And we'll work with the member to see what works best for them. But I always love to tell this story. So we had an individual who was in the program, and she had been in for about 3 months, so going on her second sprint. And during the course of her her time with Onduo, she'd actually lost about 25 pounds. So she put the CGM on for the second sprint and discovered that smack in the middle of the night, she was running into hypoglycemia, and fairly severe hypoglycemia, but was absolutely unaware of it because she was sleeping. And so with the ability to monitor those numbers with the CGM, our CDEs jumped right on that, as you can imagine, because those are not events that we want to mess around with. And we're able to move that individual into a visit with an endocrine. The endocrine was quickly able to discern that because of the weight loss, her medication dose was off. And so he was able to do a med reconciliation, get her back on a dose, and continue to monitor that over the course of the next few days to make sure everything was correct with her diabetes management. So those are the kinds of stories we love to be able to tell because it's an avoidance of what could have been a pretty severe event for the individual. And I just kind of delved into clinical intervention. I'm always getting ahead of myself, but those are the kinds of things that we love to do at Onduo.
Maybe
Go ahead.
one thing to add there, anytime that there's any kind of med reconciliation or med optimization, anytime there's a telehealth visit, there will be a summary of that encounter. So an encounter summary that's, our doctors will fill out that summary and then either electronically secure email, or if there's any kind of EMR integration, and that's a big if, depends on the client, we'll make sure that that information is passed on to the individual's primary care physician. So we're always trying to keep that PCP in the loop. Any changes that are made, we're going to inform the physician. Well, oftentimes our coaches will work with each of the members to first get permission. We might not always have data that tells us who that individual's PCP is. So we'll go about using the coaches and that relationship building with the member in order to enable that kind of bi-directional information back to the doctor. Because it's really important for us to have that physician in the loop and for the doctor to understand that we're really trying to complement his or her level of care with each patient.
Good call. Yep, absolutely. And should you want to move forward with us, because why wouldn't you? I just wanted to give a quick snapshot of the implementation timeline here. So this is an average, so about 3 months for us to get moving. We can move it faster if you're really excited about it. And so, but it is important that we do a proper due diligence on how we implement. We want to make sure that as we're talking to your employees, that we're doing that in a way that's appropriate. So we do spend a lot of time on that marketing plan, making sure that any data that comes across is in a format that's going to work, and we're very flexible with that kind of thing. But it's about 3 months until we can launch and go live.
I failed to mention at the onset that Onduo works with large self-funded groups. Mm-hmm. We work with health plans, and obviously, oftentimes when working with health plans, you're working with large self-funded groups. So we've got the experience of going what we would call selling direct or working through the health plan. Whatever is your choice and whatever makes the most sense for you and your members, I think we can support it. I know that we are both involved in other opportunities where I'm implementing with a large health plan on the East Coast that is working with their state organization of 450,000 members. Not uncommon for us to take that kind of an approach. Whereas some of our other clients, one of my other clients is a direct to employer, happens to be Walgreens. That was announced well over a year ago. We've been working with their employee population through their health plans. So it's a direct deal, but we then collaborate with each of the health plans or their TPAs to make sure that we're touching all of the members that we can.
All right. So Matt talked a little bit about in the beginning about who our kind of founding members are. One of the things that is pretty exciting is working with Verily. As you can imagine, Google's Life Sciences division is pretty on top of cutting edge technology. So our platform was really built for expansion. Wow. So chronic disease management, right? So right now the focus is on diabetes because we wanted to get that 100% correct before we decided to expand into any other kind of comorbidities. So it's not to say that if someone has hypertension and is a member of our platform who has type 2 diabetes, that our doctors are not going to talk to them about hypertension, because they are. But it's that we don't necessarily have a hypertension program right now. But as we move forward with Verily and are able to use some of that technology, the beautiful thing is it is on the enhancement roadmap. So you'll see weight management and connected scale. I mentioned a bit ago that we were in the midst of a pilot with a population utilizing that connected scale. We plan to move into hypertension in most likely next year. Don't hold me to it, but I'll keep you updated on timelines. And then stress and coping, and I think I alluded to that a bit with that diabetes distress measurement that we're already working on. So they're natural progressions as we move into the platform, and having the Verily engineers behind the platform mean it's going to be a pretty seamless integration for us. So always want to call that out.
Well, even in the course of and, roughly the year that we've been in discussions with you all, we've launched a pre-diabetes program. We've launched a healthy weight program. Those weren't necessarily on for today's agenda, but we just wanted to demonstrate to you that we are expanding not only the depth and reach within type 2 diabetes, but more broadly to work with comorbidities and other chronic conditions.
All right. Try not to be too excited. I'm done talking. So, no, and I know I joke around a lot, but we are really excited about the opportunity to work with you guys. And so we definitely want to build a partnership that works for everybody. And we'd love to take any questions that you may have at this point.
Go ahead and open it up, and I'll start with Diana. Please speak up.
I will. I just wanted to know if you are one of the diabetic management contracted vendors with Blue Cross and/or Optum Rx.
We are not currently, but we've been having kind of parallel conversations with Blue Cross Blue Shield of Texas and HCSC. We do have a number of Blues plans that are clients, so we've done a level of integration. We bill through claims, so we've got a lot of that infrastructure set up.
Yeah, I get that. I'm just wondering about the contracted with the network version of it. I mean, we do everything through our network.
Yep.
So do you have an ETA for either? What about Optum?
We're not working with Optum.
Do you have an ETA with Blue Cross?
So with other Blue Cross plans, not currently with Blue Cross Blue Shield of Texas, but when we do work, whether it's on behalf of a large self-funded group or through the health plan, we typically will sign a standard contract with them that we become part of their extended network. So it's a standard provider agreement so that we can provide the clinical services.
And you're saying you don't do that with Texas?
We would do it if ERS said, hey, we'd like to move forward with
Without
Onduo.
ERS saying anything, are you working with them today?
We do not have a current contract with Blue Cross of Texas.
You said other Blue Cross plans. Is it any other HESC plans or just other?
No.
Not right now. Yeah.
We have 3 live Blues customers and 3 in contract for next year. HCSC not being one of them.
Yeah, and we do have an overarching contract with the Blue Shield Association, and so we are on their preferred vendor list. So it does make it a little easier to move forward if someone such as yourself would like to.
Other questions?
In a typical population, out of whatever size group you want to say, 300,000, what percentage do you find participants are eligible for the program? And of the number that are eligible, what percent typically voluntarily enroll?
So 8 to
10,
10%
yeah.
would probably have type 2 diabetes, so they would all be eligible. We tend to enroll anywhere from 5 to 20% of those eligible. It really depends on the collaborative partnership, the way that we communicate together, the way that we do outreach.
And it does tend to be the employee populations. We have the higher percentage because they tend to trust their employer a little bit better than, I hate to say it on camera, the health plan sometimes doesn't have that same level of trust. So.
And does payment back to you depend on the number that enroll, or is it strictly if 0 enrolled, then we would owe you 0?
Exactly. Yep.
Yeah, in fact, we have no implementation or integration fees. It's all on a per engaged member basis, bundled payment.
I didn't hear you mention type 1. Are you helping those with type 1 diabetes?
We are not currently. There have been some discussions for further down the line, but at this time we are not.
Part of the reasoning, at least historically, has been for a type 1 diabetic, they oftentimes do have a stronger relationship with their endocrinologist. It's a lifesaver, right? So they're in better communication there, whereas part of the real value that we bring is that telehealth visit, that virtual endocrinologist ability.
And I thought I heard you say you were the only ones that can ship a CGM to the home.
So we are currently licensed in 49 out of 50 states, the 50th being Hawaii. There's a little bit of legislation there that we still have to overcome, but we are the only company who can prescribe and ship, directly to home. Prescribe and ship
I see.
directly.
So if a physician prescribed the CGM, not in your plan, and one of our vendors could ship it, they could certainly do that. I just wanna
That's-
make sure I didn't.
That's right. If they have a durable medical equipment license to ship, they
Sure.
can. That's right.
What is your, when participating as part of a network strategy, what are your reimbursement rates normally look like?
So the way that we price, and again, either direct or through a plan, we typically take a bundled price. And for, I think what we've disclosed previously is at the low end, you saw the low risk is $300 per enrolled per year. And at the high end is $1,000 per enrolled per year.
Okay, so, and if they're only enrolled for a month, it's still about $1,000.
So again, it depends on the need of the client. What we oftentimes see is we'll bill on a quarterly basis, and we'll bill through the claims mechanism. So depending on how you want to drop the various claims, some might have $0 values to the claim. Others might be part of that bundle, and we can do that on a quarterly basis, so that if somebody disengages after 3 months, we don't see them anymore, we would stop billing.
So you bill like $250 a quarter or something, is that what you're saying?
Oftentimes we front load it because of the heavy expense of the
dealing,
equipment.
yeah.
But,
Okay, so you
but
have a
basically,
quarterly payment plan.
that's right.
And is that all inclusive or
All
is.
inclusive.
even any extra coaching?
Absolutely.
Anything, seeing it or referring
Yep.
somewhere?
Correct.
The A1C test?
All included.
Correct.
What lab do you use for the A1C?
I don't remember. Do you
Yeah, so
remember?
the kit itself, it's not Quest, or it's a small licensed lab. I just can't think of, we can get you that information and follow up.
Yeah, did you have, specifically Spanish language capacity, or is it all English-based?
So right now, the app is all English-based. We have a coach who speaks Spanish, and so that's a possibility there. We also haven't had a client specifically tell us that they want us to move forward with a Spanish-speaking app. So by all means, if you want to be that client that signs on and tells us to, we're happy to talk about that. So yes.
Yeah, one of the advantages, again, of being a Google-backed company is
Yeah.
the flexibility of the technology platform. So the ability to translate and move things into the app in Spanish, they'll assure you it's relatively simple. But to Amy's point is, once a client says, yeah, we need you to do that, then we would ramp up those efforts.
Yeah.
If we were to open up our network to your company or others, what competitors would you expect be interested in participating?
I would expect Livongo would be one of the first ones that would approach you, and then
Omada.
maybe Omada, yeah.
And then there's other companies like Verta, and where we would say we're very different is, again, that ability to prescribe and ship and place, to have an endocrinologist through a telehealth visit. That's very unique and different. And then the results that we're getting, particularly for those really high risk individuals, I think it'd be really difficult for any of our competitors to touch that kind of data.
I would also assert the tiered pricing is a pretty strong differentiator. So we are charging pretty darn close to at cost for that low risk, because we want to have that solution available. But again, to the point that where we really drive those clinical outcomes is in that higher risk, and so we charge a bit more there. But again, yeah, that tiered pricing is very different.
So how do people self-refer, or are you expecting some sort of data from us that indicates someone is pre-diabetic?
So that's a good question. We love data, so anything that you're willing to share with us to help us determine who we should be focusing on is very helpful. It just depends. So if we contract through the plan for you and they are able to give us eligibility files, that's a very easy route. Some of our employer populations have done broad employee emails saying we have this benefit available to you should you choose to sign up. So again, it's going to be an individual path on how we move forward with that. Did I answer the question? I'm sorry.
She also asked about prediabetes. So one
Oh.
of the really interesting things that we've done with Walgreens, so a very large employer client, is We started with the type 2 solution. So back in February of this year, we rolled that out to the employee population. We saw good engagement in that. But they came back to us and said, we also want you to work with our pre-diabetic and just those individuals that are struggling with weight. The hypothesis being that there's probably 4 to 5 times as many type 2 diabetics that are probably pre-diabetic. And I think generally the data will support that. And so in order to really kind of meet the needs of our client, we rolled out this pre-diabetes program. We call it Onduo Healthy Weight. But what we did, what was really unique up front from an engagement and enrollment standpoint, we created a website that Walgreens employees could go to. When they went to the website, they were asked a few simple questions, and then there was an assessment with an algorithm that we built in the back end that identified them as either someone that has type 2, somebody that's likely pre-diabetic, or somebody that's neither of those but still is interested in just healthy nutrition and healthy weight, either gain or loss. And then we kind of triage them into the right program. And we saw pretty tremendous results within the first 6 weeks of that. We more than doubled the total number of people that were enrolled, and we increased even in the type 2 segment by 20%. So pretty phenomenal uptake, and it's really just been in the first couple of months. So we're looking forward to continuing that approach, and we'd love to take that approach with other clients as well, because we just know there's many more people that have prediabetes than type 2.
So I promised my last question. So you mentioned earlier that you primarily look at those with agencies that they were above, primarily that's your probably what those stand foods, right? Let's say you have someone with an 8 who drops because it's been so great to a 5.5 or 6, and they maintain it for a few months. Do they stay on your program forever?
That's a great question.
At the same FNDs forever?
Great question. So
Even
they.
if they're kind of what a normal person, they won't see it.
So that's going to be partially determined by you on if you want it to be open to your entire population, or if some of our clients choose to have an A1C cutoff, so they only want us to focus on high risk. But if you open it to the entire population and you have someone who is controlled from an A1C perspective, but they are actively using the app or interacting with the coach or doing one of those behaviors that we would determine as engaged, then we would allow that person to stay on at the $300 a year until they did not want to stay on anymore. There's no set graduation date.
Are you far enough along that you can tell us if there's any return on your investment?
That is an awesome question. So we are just now starting to get the cost savings data really ironed out. So we expect to have that soon. I think it's still slated for before year end, right? So we have some directional cost savings data. I will give it to you, but I will also hedge that by saying it doesn't include any avoidance of clinical escalations. And so if you're looking at things like the Milliman study, it's something like $11,000 to $14,000 in cost avoidance for one hospitalization with hypoglycemic event. We don't have that included in our cost savings data right now, so it's primarily just based on med reconciliation, and some A1C reductions. So we're looking right now directionally at $640 on the people who have stayed in the program. But that's, again, directional, so it's very preliminary, and we don't know where it's going to
We
pan
can
out.
certainly share with you the methodology
Yeah.
that we'll use.
Explain the $640 to what is.
It's a lot based on the med reconciliation, so saving money on the amount of medications prescribed and utilized by the individual over the course of the year.
So for every, what amount do we spend to get a return of $640, is that what you said?
So we would have to probably pull that in from Gilbert. I don't have all of the data for that right now. So we can absolutely pull that methodology for you. And again, it's preliminary and directional, so it's not concrete yet.
But that's, you're saying, very roughly understand.
Yes.
$1,000 spent for a high-risk participant, and then using your methodology, maybe $640 in savings, so there's still a net cost there to the plan, but you're not including cost avoidance due to
Correct.
ER visits or
Correct.
anything.
And the problem with cost savings in a year one of a type 2 diabetes population is you typically aren't going to see a lot of cost savings for that year one. It's going to be further out into that year 2, year 3. So that's really where that bet is hedging.
I have a question about
participation. So each enrollee is set up with an individualized care plan.
Yes.
What do you know offhand what the rough ratio is for participants to clinicians, coaches?
Yeah, a caseload for a coach is targeted at scale at 1 to 1,000. Right now, we're at 1 to 350, 1 to 400.
Okay. And what drives their frequency of the CGM utilization? So you mentioned there's 7 to 10 day sprints. You said that's that they'll use the CGM. The enrollee will use the CGM multiple times a year. For a typical case, how many times is that participant having to wear that device?
Let's say typically 3, but again, it's going to depend on clinical necessity. So if they're not improving or if something's struggling, then they may have more CGM wears than others.
Regardless if they have to wear it 3 times in a year
Yep.
or say 12 times in a year.
Same price.
Same.
Yep.
Any other questions?
Yes.
So if a participant stays in after year 1, does the cost per participant go down if they're not getting CGM?
Yes. We've certainly done that with other clients. Now, remember, we're just finishing our 2nd year with clients, so we're starting to see that. But one of the direct-to-employer opportunities that we sold, we certainly built that in because we recognize some of that upfront cost. The TelCare meter, if they're going to be around next year, we're not sending them another meter, so we reduce the cost.
Yep.
Do you have any state plans at the moment?
Just an implementation. We're not currently servicing, but like I said, I'm working with one on the East Coast, and you've got one in the Midwest.
Midwest. Yep.
Very few as large as this one.
Any other questions?
Oh, yes, of course.
Okay, well, that concludes today's solution session. I want to thank Matt and Amy from Onduo for being here today and for their presentation. For those of you tuning in online, as well as those of you attending here in person, thanks for being here, and we'll see you next time. Thanks.